All right, hey there, everyone. This is Demetrios, Kydonieus, chiropractor and nutritionist for over 33 years. Practice still full-time, going strong, enjoying helping the community. Just love what I do. And this message is really going out there to other doctors, other chiropractors. I've been talking and meeting with a lot of different younger chiropractors or even chiros who've been in practice like 20 years or so. And communication is still kind of a hang-up. Communication starts from the first time you meet your patient to the first time you put your hands on them. And especially in the adjusting room. Now, I'm an activator guy. I do a lot of deep tissue work, which can get kind of personal. So I'm always aware of my patient's perspective that this is new and something that they're not used to. So I will always explain to them, I said, okay, I'm going to put my hands here. We're going to be doing this for this muscle. We're going to be working on this part of the body for this joint subluxation, or if it's an extremity, talk about a shoulder fixation. And if I'm working on something that's getting in a personal area, I'm going to always say, so now I'm working on the chest muscle. We want to ease that tendon up a little bit and make sure you can get some movement back so that they're have a better understanding of why I'm, kind of moving around, and it might be doing it quickly and automatic for you and me, but for them, they might be a little nervous, a little apprehensive. They don't really know me yet. So I want to make sure there's a good line of communication where they can ask questions and they're aware of what my hands are going to do before I do it. So if you're a skin-to-skin chiropractor and you need to really feel sensations through the skin with your fingers, totally get it. Remember, though, your patients might not get it. So especially with the ladies, if you have a patient laying face down and you're above them, okay, and you're working on their lumbar spine or their thoracolumbar area, let alone down by the sacrum and the glutes, that's a very personal area for a lot of people. They feel very vulnerable because they're face down and they can't see what's going, right? So I'm going to always say, if you're going skin to skin, I'm going to give them a little bit of a heads up and say, okay, I'm going to work a little on your lumbar back, on your lumbar spine, and I need to kind of feel what the skin is doing and the texture's like, what your muscles are doing under that skin, and then that just tends to relax them. So I'm not picking up their emotional tension, and they feel more at ease that everything is above board and totally professional. And as you start working down towards the sacroiliac joints, the SIs, the glutes, remember, that's a very private area for most people. So I'm going to let them know. I'm going to say right here, we're going to be working towards your sacrum and your SI joint. And we got these big hip muscles, basically, I'll say, or your butt muscles. And they can get big knots in them. And instead of having a more kind of open palm approach, I might use a thumb, which is very clinical, very non-personal, if you will. And first start out there as I'm working down the SI joint into the glute fibers along the iliac crest, let alone down towards the acetabulum and the hip joint. This way they relax, they know everything you're doing is proper and professional, and that builds visit after visit, and they feel very at ease, and you're going to get the results that you need and they're looking for, and your patient will be very comfortable. Now I work through shirts, t-shirts, sweaters, whatever they're wearing. I don't always have to go skin to skin. So anytime you can do that, it keeps it very nonchalant, very professional, and there's no question about propriety or being a little over personal. And I've had some patients ask me, you don't do this, do you? I had a chiropractor kind of put his hands here and it felt inappropriate. And I'm like, no, if I need to go in that area, I'm going to let you know. Or I can work through your through your shirt if I'm up by the ribs around the bra strap in the back area, let alone if I'm doing something in the front where I got to release the pectoral or I got to work on the rib heads by the sternum. I'm going to say before I go in, I kind of go in with fingertips so it looks very, again, clinical, not personal. And I'm saying, we're going to work on these rib heads a little bit. Is it okay if I go here in kind of the middle part of your chest by the rib bones? I don't say breast, I don't say chest muscle. I keep it very clinical, and my lady patients will always relax, and of course they're having some pain there. That's why I'm there. And they say, sure, doc, that sounds great to me. And of course, in that position, they are face up. They're watching what I'm doing, and there's no question about the professional necessity to work these muscles along the sternal plate and everything. So just a tip, Chiros, let's keep our image up there. I've gotten different comments from literally family members that live far away and can't see me anymore, and they say, you know, Dad, this chiro, he kind of seemed like a little handsy. And I'm like, more than likely, this is what he was doing, and he just didn't really think about it because he's been doing it for like 15 or 20 years, and he wants to just dive in and do that chiropractic adjustment or work that soft tissue. And then she relaxed about it, and upon asking conversation, he was like, oh, okay, yeah, you know, I'll give you a heads up next time if that makes you feel more relaxed. And that smooth things out. So, all right, Chiros, keep helping people, keep taking care of the world, and keep communication open and let your patients know what you're doing before you put your hands on them, before you do it. And same thing, if you're doing a cervical break or a rotary move in the neck, I'm always letting my patients know that I'm going to kind of go in here and we're going to do like a little bit of a torque or a twist, and not to get that nervous so that they don't think somebody's going to spin their head all in circles and stuff and freak them out. So have a good one. Talk to you soon.